From the JAMA Network, this is JAMA Neurology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Neurology.
My name is Dr. Cynthia Armand, Associate Professor of Neurology at Albert Einstein College of Medicine, Montefiore Medical Center, and JAMA Neurology Web Editor. Today, we're going to be discussing work entitled Neuropathologic and Clinical Findings in Young Contact Sport Athletes Exposed to Repetitive Head Impacts. This is a very interesting and relevant topic, and I'm excited to have with me Dr. McKee. Dr. McKee is the William Fairfield Warren Distinguished Professor of Neurology and Pathology at Boston University. She's the Director of Neuropathology for the VA Boston and Director of the Boston University Chronic Traumatic Encephalopathy Center. Dr. McKee, it's wonderful to have you on the podcast today.
Thank you. It's a pleasure to be here.
And I just want to say that your work has been remarkable in this field of CTE, chronic traumatic encephalopathy. And I wanted you to give our listeners a background of chronic traumatic encephalopathy, what's known right now, and how does this tie to the current work that we're going to be discussing?
So chronic traumatic encephalopathy is a neurodegenerative disease. It's defined by tau protein, a buildup of tau protein in the brain. And in almost every case, like 97% of cases, it is associated with exposure to repetitive head impacts. And we find this disease in athletes, contact and collision sport athletes, but also other people like military veterans who've been exposed to blast or other traumatic head injuries, victims of interpersonal violence, that kind of thing.
In the current landscape of this topic of CTE, what's currently known and what were you looking to find in your current research study?
So we know that CTE is a neurodegenerative disease that affects individuals who've been exposed to repetitive head impacts. We most often diagnose this in older individuals, people in their 50s and 60s. But ever since we started the Brain Bank looking for these late sequelae of brain trauma, we've known that it can occur in young people. And so what we wanted to do with this study was look at the 152 athletes that had donated their brain to our bank and died before their 30th birthday. And the reason for that was we wanted to see, first of all, how common is CTE in this brain donor population and what it looks like, because we know that young individuals don't have other illnesses, other comorbidities. We thought we would see really the purest forms of this very early manifestations of CTE.
Yes, I've had this discussion about CTE and a lot of athletes who've retired. We've been seeing this come up, but really, we always ask this question, when does this start to develop and are young individuals at risk? So it's really, really important study that we're discussing. Tell us about your methods and how you formulated the study. And I want to know also about the different sports that were involved, where the donors came from and what they engaged in.
Sure. So it's a brain donation population. In order for us to have the brain donor come into the bank, the family calls us, reaches out at the time of death, usually after death, but sometimes right before the death. And we arrange to have the brain removed in their vicinity, but then flown to us by courier. The pathologists get to work on dissecting and processing the case without any knowledge of what the individual was like during life. And that process takes about 2 to 3 months, but we do that entirely independently and blinded to any information. And meanwhile, we have a clinical team who talks to the family members, the next of kin, the mom and dad, the spouse, whoever is available, to get as much clinical history as we can about the individual that's died. We'll also get the medical records and we'll review all of that material prior to coming to what we call a consensus meeting. So the clinicians do it blinded to the pathologists are blinded to the clinicians. But at this consensus meeting, we present the clinical summary of the individual, and then the pathologists present the neuropathologic findings, and we reconcile the two. Then after that, after we've discussed it amongst ourselves. We'll call the family and we'll have an informing call with the family members, usually on a Zoom meeting.
Now, out of the brain donor population, what numbers are we talking about, and what were the backgrounds of the individuals and the particular sports that they played?
Sure. So we have nearly 1,400 brains now in the brain bank. We've been working on it for about 16 years now. And we had, at the time of this study, which ended last September, we had 152 individuals who had donated their brain having not reached their 30th birthday. They came to us from various sports. Football was the most common, American football, but there's ice hockey, there's soccer, there's rugby, there's amateur wrestling, and some other exposures, but those are the main sports that were involved.
And in your study, what were you looking at, your outcome measures, and particularly looking to find with this population?
Well, first and foremost, we're looking for this diagnosis of CTE, which can be made microscopically based on the presence of tau protein in a very specific configuration in the brain. The criteria for diagnosis have been established by several consensus meetings. So we were looking for CTE, but we also very, very methodically categorize all of the neuropathologic changes in the brain. So we look at brain weight, we look at, is there any ventricular enlargement? Is there any evidence of atrophy? Or is there something called a cavum septum pellucidum, which is a splitting of an internal membrane inside the brain? And we make very detailed notes and data points regarding the neuropathology. And that is done in concert with getting as much clinical data as we can about how the person was during life.
Right. Yeah, tell us about your results.
So what we found was, of the 152 brain donors under the age of 30, we found that 63 were diagnosed with CTE so that gives a percentage of about 41.4%. Most of those cases were mild CTE. CTE has 4 stages. 4 is the worst. We found in 60 of these 63, they had stages 1 and 2, so mild CTE. And we felt this was notable because of the young age of the brain donors. We did find that those who were diagnosed with CTE tended to be older than those who did not have CTE by about 4 years. The ones with CTE, about 25, those without CTE, about 21. Of those that played football, they tended to play the game longer, and they tended to have a higher educational status, and that most likely represents just the longer playing time. College years are associated with additional years of play. And we did find that almost all of the individuals with CTE were men, but there was one woman, a 28-year-old former collegiate soccer player, who was also diagnosed with CTE.
That gender difference, do you think it was due to specific sports cohorts that were coming forth?
I should preface it by saying we get far fewer female brain donations than men. It was about 7% of the sample. We wish we had more women donating to the bank, but historically these sports have been played by men, and men have comprised the majority of our brain donors. We did get 11 females, though, and of the 11, we did have one who had evidence of CTE. This, to our knowledge, is the first amateur soccer player that's ever been described as a female with CTE. There was a recent report of a ex-professional Australian rules football player, but this would be the first amateur athlete with CTE who is also female.
The study is remarkable. When I think about young individuals and the donor brain showing signs of early CTE, it's just something to me that's so striking. My first response to this is, clinically, what can someone possibly see in their child or their loved one who is engaging in these types of sports that have repetitive head impacts? What can they see as an early sign or something, stage 1, stage 2, that correlates?
Right, and that's a really important question because this is a brain donor population, all of the subjects were symptomatic. The families were concerned about each and every one of these individuals, and the symptoms were common across the board. The symptoms of apathy, depression, feeling like they had difficulty controlling their behaviors or decisions, impulsivity, those were common whether or not they had CTE. In fact, we weren't able, given our retrospective interview with the family, we weren't able to pull out what symptoms were correlated with the presence of CTE or not. And this is a very important aspect of the study for many reasons, but one of them is when young athletes are symptomatic, when they're concerned that they've had repetitive head injuries and they might be developing CTE, most of these cases, 60%, did not have CTE. They had symptoms that were related perhaps to the repetitive head impacts, perhaps related to other aspects of their life. And so importantly, it emphasizes that these athletes who are feeling changes, feeling like they're behaving or feeling in different ways, they need to come in and be taken care of. They need to be looked after and they need to be followed, because in most instances, they will not have CTE and they might have something that's very amenable to therapeutic management. And so it just reemphasizes that just because you have symptoms, it's not all CTE. And please come in for care because a lot of these symptoms can be managed.
Right, that's an important point because in my previous conversations, I have a lot of friends who have young children, and the question is, we would like them to play a sport. What should they play? Should I stay away from football? Should I stay away from soccer? And the fact of the matter is, whatever sport you are playing and whatever is happening, if there are signs or symptoms of something developing, yes, care should be sought immediately. But this is really important, a point that you make.
Yeah. And also the other thing about the sports that were involved is all of these sports, especially football, but rugby, ice hockey, soccer even, they're all associated with impacts to the head. These are sports where there's collisions and contact and there's repetitive hits to the head. And it's not just the concussions, right? There's been so much emphasis on concussion, but most of these impacts to the head do not cause concussive symptoms. They're what we call non-concussive injuries. And it's the buildup of these small hits, these hits that don't cause symptoms, that aren't concussion, that in all of our studies, including this one, increase the risk for CTE. So you want to avoid head contact, head impact in the sports that your children are playing.
And helmets, what do you think about? I mean, we all should wear helmets, but
So helmets aren't the answer to this. Helmets are important for things like skull fractures and, very severe hemorrhages and bleeding. But the fact of the matter is they don't really help mitigate these acceleration-deceleration injuries, these rotational injuries that occur in these games. It's something that's happening inside the skull, and the helmet is really on top of the skull. So you still have that same very rapid acceleration-deceleration rotational injury that leads to the damage in the brain. So helmets definitely are helpful, but they're not the answer to this particular problem.
yes, a hard truth from Dr. McKee here. What's next in this realm of study and as a continuation of this project?
Well, I think, we have identified this disease can start quite early. It can start in amateur athletics. So clearly we want to be able to identify this during life. And that's one of our main focuses with all of this work is how to diagnose this disease during life so that people that are suffering and that might be affected can get care. So we want to continue this work. We want to continue to look at young athletes prospectively, have them come into the clinic so that we can evaluate them with a very sophisticated neurologic and neuropsychological battery, so we can get a much more granular view of what the symptoms and behaviors they may be experiencing. We need, in terms of our brain donor population, we need the study of controls. This is a very difficult population to study because very few autopsies are done on these young people. So what we need, and we're working with other groups throughout the country to try to get autopsies and brain autopsies on individuals who don't play contact sports so that we can really understand the distinctions between exposure to contact sport and those people that were never exposed. We know that many of the people in this study, most of them died from suicide and unintentional overdose. Those are things we clearly want to prevent. So we just want to focus on getting these people into the clinic so that we can help sort things out and manage their symptoms.
Dr. McKee, thank you so much for joining us today. I'm sure our listeners will be thrilled to learn more about this and look forward to your work in the future.
Oh, thanks. I appreciate you having me. I just want to say that we have a whole team of individuals. We have a 24/7 brain donor number that's populated by research assistants. This takes a huge team of people to be able to do this work. And I'm extremely grateful to my team of 50 plus individuals who work in such a dedicated manner to be able to bring this kind of research to the public. And I just want to thank my team for that, and especially the families who made the brain donation and made this work possible.
Great. I'm Dr. Cynthia Armand, and I've been speaking with Dr. Ann McKee about neuropathologic and clinical findings in young contact sport athletes exposed to repetitive head impacts. You can find a link to the paper in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for the JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.